Hello and welcome to the 9 News Business Buzz, where we take up what's happening in business, how it impacts you and our economy. I'm Ryan Frazier, your host, 9 News business expert and CEO of Frazier Global. Today, we're joined by a very special guest, Laura Rizzo from Intermountain Health. Laura, welcome on the show.
Thanks so much for having me.
It's great to have you. We're going to talk about 340B, which is a pretty contentious issue down at the state capitol. Now, the 340B program requires drug manufacturers to provide discounts to eligible hospitals and clinics, but there's a debate about how these discounts are being used and whether they're benefiting the low-income patients they're intended to. Break this down further for us.
There's absolutely a battle brewing at the Capitol. Sometimes it feels like everybody's working on this issue. And while hospitals, providers, and pharma share a lot of similar goals, we also share a lot of similar challenges. This is an issue where we see the world very differently. And as manufacturers have stepped back from these discounts that are so critical for hospitals, we're simply asking to maintain the status quo of the program as it's been for decades.
Now, Laura, the 340B program has grown significantly in recent years, with total discounts reaching tens of billions of dollars nationally. This has intensified the debate over its use and the potential for abuse. Now, pharma folks often say the money isn't following the patients. How do you respond to concerns about the program and its intended use?
Yeah, that's a great question. You know, 340B was never intended to be a direct-to-patient discount. There are programs out there that are direct-to-patient discounts, and they're fantastic. But what the 340B program is really intended to do is to help offset some of the underpayment and uncompensated care that specific types of hospitals and health clinics experience. So in order to qualify for this program, you have to serve a disproportionate share of Medicaid or Medicare patients. And this is intended to help offset some of the losses that hospitals experience to ensure that we can continue to provide charity care and invest in our communities.
Yeah. So talk a little bit more about how this program, as it is today, benefits those low-income patients. And let's go into the bill that is being advocated for by many in the hospital community down at the state capitol.
The purpose of Senate Bill 71 is to prohibit manufacturers from restricting the 340B program. It's something that we've seen over the last few years where manufacturers are really stepping back from this program, and it puts hospitals, which at this moment in time are faced with a lot of financial unpredictability given the situation at the state with the state budget and given the federal unpredictability of Medicaid and Medicare funding, it puts us in an even more challenging position as so many hospitals have come to rely on the savings from this program to help fund our charity care programs.
So basically the bill that you all in the hospital community are advocating for is seeking to tell pharma you can't put further restrictions on our ability to administer this program.
Yeah, maintain the status quo that we've had for decades.
Yeah, and in doing so, you all believe that it will continue to benefit those patients that it was intended to do so.
Absolutely. It provides hospitals like ours, we're a nonprofit health system, with the ability to provide more charity care in our community, to partner with nonprofits in the ways that we see fit, to provide drug discounts, to help people cover their co-payments on really expensive pharmaceuticals. But what's been great about the 340B program for us is that it does provide flexibility. So we do a unique community needs assessment at every one of our hospitals, and that helps us understand where our community benefit dollars can have the most impact. And that looks very different in urban Denver than it does in Grand Junction, for example.
Now, some critics argue that hospitals contracting with contract pharmacies to expand the 340B program beyond its congressional intent. How do you respond to that?
Certainly the 340B program has evolved, and the use of contract pharmacies has evolved as well. I think it's really due to three things. You know, the first thing is contracting with carriers. Sometimes we're required to contract with certain pharmacies because of those contracts with our carriers. The other is there are some really rare drugs that are available at only a handful of pharmacies across the country. It's important for us to contract with those as well. And the third and most important thing is about patient access. So for us, I'll give an example. We have a hospital in Grand Junction. Our patients are coming from 50, 60, 70 miles away to seek care at our facility. We think it's important that they be able to fill their pharmaceuticals in the community where they live, and they aren't forced to come back to our hospital to fill those prescriptions. It's better for their healing and it's better for their outcome.
So let's dig into this a little bit more, Laura. So for our folks who are watching, this 340B program allows hospitals to buy higher priced drugs at a lower cost, thus realizing those savings, which should be passed on to patients in many cases. Obviously, some argue that it's not. Can you give us some examples of where 340B savings are utilized?
I mean, the primary function for us is in charity care. And when I say charity care, what that means is it's the care that we provide that we won't get paid for. We either offer highly discounted care or care that's completely free of charge, depending on the patient's financial situation. So charity care is, of course, a place. You see that we have a lot of pharmaceutical discount programs as well, where we're maybe covering the copayment of several $1,000s on a cancer treatment or a cancer drug, and a patient is faced with a really tough decision about if they're going to do that treatment or not. We can help cover that. And the third is that we partner with nonprofits in our community, and these dollars are used in those partnerships in many cases. So it's really, it's not money in the door for us, it's money that we don't have to spend on pharmaceuticals that we're able to put towards other uses that expand access in our community.
Now we know, we've seen the headlines that many hospitals around the country, not just here in Colorado, are struggling, having thin margins, trying to stay alive in order to provide that access. But I want to make this a little personal, if you will, for those who might be viewing and who are still looking at it and saying, how does this really impact me or my mom or my grandmother? So, Laura, if you were sitting across the table from grandma, what would you say about the importance of 340B?
I would say that 340B is a critical lifeline for nonprofit health systems and community health clinics to ensure further financial sustainability, which is not something that we have a lot of today. And while I think that can seem unbelievable for people, it really is the truth. You know, we don't know what's going to happen to our payments from Medicaid and from Medicare, given what's happening federally. We're seeing, you know, potential provider cuts at the state level. And so we really are faced with a lot of financial unpredictability. This is an important stabilizing factors that hospitals like ours have come to rely on. And when you remove stabilizing factors like this, there is the chance that you see service lines that don't make money, you know, end up having to close, or we have to pull back on access, and that's the very last thing that we want to do, particularly in our rural communities where there's not another provider there.
Yeah, I have a feeling that this issue is going to be around for some time. I know that it has to reach its ending point at the state capitol, but there's going to continue to be a debate and discussion about this both here in Colorado and nationally. Absolutely. Laura Rizzo with Intermountain Health, thank you so much for joining us.
Thank you.
All right, let's turn our attention to another pressing issue, federal job cuts. These cuts have been making headlines, and Colorado has a pretty big federal workforce. I'm joined here by my partner in crime, Ed Sealover of the Colorado Chamber of Commerce and the editor of Sum and Substance. Ed, you've been seeing the headlines. There's a lot of concern about how these potential cuts, whether it be in education or in parks, could impact our Colorado economy. What's your perspective on this?
Well, there are both opportunities and challenges that are coming out of this for the Colorado economy. First of all, let's acknowledge the challenges here. These are 57,000 potential people who will not be collecting paychecks. These are folks who use those paychecks now to go to local restaurants, to retailers, to clubs, to purchase things. They're going to have to cut back on that spending right now. And for a lot of businesses, especially those that are concentrated around federal workforce centers, say national parks, that's going to be a cutback in what they're going to see. You know, and that's just from the business perspective. Obviously, you acknowledge too that these are 57,000 people who are not going to have paychecks, and that is going to scare the heck out of them, as it should anyone who is going to be losing their job. But just from an economic perspective, those challenges exist. There are opportunities, though. I will say this. There are more than 120,000 job openings in the state. There are more job openings than there are unemployed Coloradans in this state. And these folks who are losing jobs are not going out into a market where there's nothing there for them. Now, you have to match skills, and you have to understand what your years of experience may line up to in the private sector. But there are a lot of employers who said, I can't hire because I can't find people with the skills needed to do these jobs, whether that be in technology, whether that be in construction, whether that be in healthcare. Here are folks coming onto the market that are going to bring a unique life set of skills and unique experience, and there will be opportunities out there. And some employers may look at this and say, this is terrible, but maybe these folks have the experience and the skills I need to fill the jobs I haven't been able to fill.
That's an excellent point, Ed. I think one of the things we have to keep in mind here is that the exact number of the federal job cuts are unclear. But the recent layoffs that we have seen at places like the Rocky Mountain National Park does serve as a stark reminder that this is very real and could have implications for our economy. For instance, the ability to continue to grow our tourism economy, and the ability to service people at the parks, as an example, or the numbers of people who tend to go to our parks. And so that could have both economic impact in terms of not only employees who are laid off, but people's ability to enjoy the parks here in Colorado. But I do think there's something to be said about one of the biggest, arguments for some of the cuts is that the federal government has just gotten too big, too unwieldy, and there's a need to kind of reshuffle the deck. Now, how that impacts us here locally is to be seen, but I don't think you can discount that argument that the federal government has gotten very big and there's a need to make some reductions. And anytime you're making reductions, it's tough. Anytime you're cutting jobs, it's tough. It's going to affect families. It's going to affect our local communities, and it will affect our economy. From a chamber perspective, though, I'm interested to hear, what is your take on the ability to continue to grow our economy when we're seeing potentially pretty major cuts to our federal workforce?
Well, let's think about this. This is a two-part process. The federal government is now cutting jobs and it's saving spending. What are they going to do with that money they're saving? I mean, we're not seeing that input back into the community yet. And this is admittedly not an immediate process, but are those going to go back to the community in forms of tax cuts that entrepreneurs may be able to use to grow their businesses? Are they going to go back to the community in forms of maybe cuts in regulations that employees will use? If the federal government cuts all these jobs and sits on the money, we are not going to see a big benefit to the economy. The federal government needs to react now and say, okay, we are saving. How do we pass those savings along to individuals and through individuals to employers who can then turn around and hire people with this, benefits from those savings? That is what we still have to see.
I kind of wonder as well, does this underscore the need, and this is a big part of what you all work on at the Chamber, does this underscore the need for Colorado to continue to attract new industries and create more jobs in different sectors so that folks who are laid off from one sector, whether it be due to federal job cuts or AI that's changing industries, have opportunities to go into different jobs and pursue different careers. Maybe they're related to what they were doing before. Maybe it's a complete rewiring of their career. But it kind of underscores to me the need to not depend on the federal government as much, because you can see these types of ebbs and flows and changes within the federal government, depending on who's in charge, and the need for private industry to really have the ability to continue to grow and create more jobs so that people who are laid off for whatever reason have somewhere to go.
Before we ever had the discussion about Colorado not depending on the federal government so much, we had the discussion about Colorado being not so dependent on a single industry. Remember, back in the early 1980s, we saw a lot of busts in the oil and gas industry. Entire Western Slope towns were decimated by this, and entire buildings in downtown Denver were emptied out. And that was when chamber leaders from across the state got together and said, we need to diversify the economy. We need to look more at finance. We need to look more at the growing, what was then a nascent technology sector. We need to look at ways that we can have other jobs so that if this one industry abandons us, cuts back, leaves town, et cetera, and that doesn't apply just to oil and gas, but that could apply to any industry, right, we have other areas where these workers can go. And I think that's very true here with the federal government too. And the federal government, saying the federal government is an industry is a bit broad. There's a lot of skills involved in people in the federal government, but this is important to know that we should have a lot of industries that these workers can now go to, and that should be a call that we continue to hear.
I think it's very important to remember these are real people with real lives, and they have real families to take care of. So let's move on to another pivotal issue facing Colorado's economy, and that's the skills gap. There's a growing concern that many graduates lack the skills that employers need, hindering economic growth potentially and individual career advancement. Ed, you've been involved with a public-private effort to address this issue. Tell us more about the problem and the solutions being worked on.
So two numbers stand out to me when I talk about this problem. That is, in 2020, for the first time in as long as the state was recording it, less than 50% of Colorado's high school graduates went on to get any kind of advanced degree. We're not talking 4-year degrees here. We're not talking 2-year degrees. We're talking even technology certificates. 50% plus of Colorado high school graduates got their diplomas, walked, and said, okay, now what do I do? Meanwhile, state reports show that 91.6% of the jobs that pay family-sustaining wages need some sort of advanced advanced degree. Again, not necessarily a bachelor's. That can be a 6-month immersion course in cybersecurity. But you need something. So we have this big pool of people who are underskilled and a big pool of employers who want to hire people but can't find the people with the skills they need. For 2 years now, we've been working on what's known as the Opportunity Now Regional Talent Summit Initiative. And that's something we've been doing along with other business-focused groups like Colorado Succeeds, Colorado Thrives, and the state government, particularly the Office of Economic Development and International Trade. From February through June, there are going to be 7 summits across the state in which employers and educators will sit down together at the same table. They will discuss what the talent gaps are and the kind of skills that employers are not finding that they need to expand and grow their businesses and create more jobs, and how employers and educators can work together to create the career pathways to do that. Not just sitting and saying, you're not doing this, you're not doing that, but saying, how do we create this new certification course, for example, and get the students into jobs that will prosper for them?
Yeah, you know, as far as I can remember, right, there's been this ongoing discussion or I guess I'll say concern about the middle skills jobs gap, those jobs that don't require a 4-year degree but require more education than, say, a high school diploma. And that gap has tended to be around 10% or so persistently over the past few years, several years for that matter. But it goes beyond technical skills. It also includes soft skills like communications, problem solving, critical thinking. Talk to us a little bit about some of those, I guess, significant skills gaps that you all are seeing already.
It was very interesting. At the first Opportunity Now Regional Talent Summit on February 25th at the University of Northern Colorado, we heard that a lot. We asked, I was taking part in the advanced manufacturing sector discussions, and we asked the manufacturers, what are the skills you need? We expected to hear this mechanical skill, this, blah, blah, blah. And a lot of them said, I need resilience, I need teamwork, I need communication. And that is going to be a bigger issue that we are going to need to address. There feels like there is a gap in what students coming out of all levels of school right now are able to think through and do, and how to problem solve. That is not something you solve overnight. But in addition to that, we need to get students thinking about how what they do well and how they do think through things, how that translates into a career. And I think one of the things you hear most from employers is they want to be more present in the educational system, whether that be career fairs, whether that be hosting field trips, whether that be hosting work-based learning opportunities to introduce students, especially those who are not thinking about going to 4-year universities, to the range of sustainable careers they can be a part of.
Yeah, I think about, for instance, what's happening not only with your regional summits, but at places like MSU, Denver, that has their new Classroom to Career Hub as an example of helping bring industry and students together. I imagine you all, through your partnerships, will be tapping into those efforts to try to take advantage of those. And I'd love you to shine a little bit more light on how businesses can really play a role in shaping curriculum and providing those hands-on learning experiences.
It's a very important question. Businesses need to think, what can I do? And that can start with working with local educational institutions, whether that be community colleges, whether it be K-12 school districts, to say, here's the skills I'm looking for. I will help you design curricula for the students that are going through here. It's not just I'd like you to produce students with these skills. It's how do we sit down and work on this together? Maybe that can also involve donating equipment. There are a number of career technical education centers that are growing up across the state that are teaching kids to do everything from basic mechanic work to fixing electric vehicles. How do I give them the equipment where they can learn and be ready to go into the workforce? And frankly, it may even involve, how do I contribute teachers to this? The folks who are in some of these CTE programs are not your full-time teachers. They're people from industry who bring their skill set and their ability to talk to students. That may be something you may ask yourself, if I'm having trouble finding the talent I need, can I open up one of my employees to go teach that talent, so that we've almost got a talent pipeline starting in school running right through not just my job, but other folks in the sector as well.
And this is clearly a very important topic, whether it be high school graduates or older adults who are looking to retrain, or even older Americans who just want to have skills they can use to stay productive in life. Very important effort that you all are undertaking. We got to run, though. We've covered a lot of ground here today, from drug pricing to federal job cuts to fixing the skills gap. Be sure to tune in each week to the Business Buzz. For the 9 News Business Buzz, my partner Ed Sealover, I'm Ryan Frazier. Until next time.